Hello, my name is Madison Kauth, and I will be talking about Crohn's disease. So, Crohn's disease was named after Dr. Burrell in 1932. This autoimmune disease was described by Dr. Burrell and his colleagues. It is a type of inflammatory bowel disease, and it causes inflammation at any part of the digestive tract, but mainly in the small intestine and colon. So there are 5 main types of Crohn's disease, and then the other one isn't as common, but is still considered a type of Crohn's. But the type of Crohn's that a person has depends on where the inflammation is at in the digestive tract. So the small intestine is divided up into 3 regions. From the top to the bottom, there is the duodenum, and then the jejunum, and then the ileum. So the main type of Crohn's is ileocolitis, and that is the inflammation of the ileum and then the colon. So as you can see right here, it's the bottom of the small intestines and part of the colon. There's ileitis, which is just the ileum, and then gastroduodenal, which is part of the stomach, and then the duodenum. And then there is the jejunoileitis, which is the inflammation of just the jejunum. And then this last one does not involve the small intestines, it is just inflammation of the colon. And then perianal, as I said before, isn't as common as the other 5 types of Crohn's. The symptoms of Crohn's varies within the different types, but they include diarrhea, fatigue, abdominal pain, weight loss, bloating, blood and stool. Some may experience a fever, loss of appetite. The joints could be swollen and painful. There could be mouth ulcers as well. So the main cause of Crohn's isn't 100% known yet, but many people think that it is diet related. However, the diet plays a role in more of aggravating a response instead of inducing the response. So a response has to already be induced in order for diet to play a role in making it worse. But some factors that could generate a response is genetic, there's molecular mimicry, or environmental factors. Environmental factors could be from smoking, changing medications, taking non-steroidal anti-inflammatory drugs like naproxen or ibuprofen, and this would just make the inflammation worse in the digestive tract. And then chronic stress could also play a role in the response. Crohn's also comes with different flare-ups, so some symptoms may be worse at different times. The main cells that are involved in Crohn's are T lymphocytes, and T cells' main role is to protect the body from infection. So if there is an abnormal T cell response, this could possibly play a role in Crohn's disease. The inflammation in Crohn's is mainly induced by Th1 cells. Th1 cells generate an immune response against intracellular antigens. And from the picture, you can see right here that Th1 secretes these 3 cytokines, which is involved with cell-mediated response and, more importantly, inflammation. And inflammation is a main factor to this disease. So some patients seem to have a mutation in the CARD15 gene. And this CARD15 gene is a intracellular protein in monocytes and macrophages. And they have high binding affinity for LPS. So when LPS and CARD15 binds, it activates NFK1. And NFK1 plays a role in Th1 differentiating, and there is and stimulates transcription of many genes that encode for pro-inflammatory molecules. So these pro-inflammatory molecules, again, is not helping with the inflammation in the digestive tract. So saying this, overall, the mutation in CARD15 gene just leads to a domino effect and will not be effective in clearing out the bacterial infection and will overall proliferate mucus. So Crohn's disease is diagnosed clinically, and it involves many tests to finally come to Crohn's. So it cannot be diagnosed just based off of one test. Some tests include biopsy, so it's just the removal of a tissue. Blood tests could help doctors measure the white blood cell in the blood, so this could give a sign of inflammation, which is of course associated with Crohn's. But the main test that is used is colonoscopy, and right here is a colonoscopy of a patient that has Crohn's, and there are these lesions in the digestive tract, and you can see how inflamed it is and how it doesn't look normal. Another type is chromoendoscopy, which is technically the same thing as colonoscopy, but it uses blue dye. The blue dye essentially makes the lesions more easier to see. Some complications from Crohn's disease include intestinal strictures, which is the narrow of the small intestines. So from the picture up top, you can see that the intestines narrows, so food will have a hard time going through the intestines, which could essentially block it. There is also fistulas, which is the abnormal connection between organs. So right here you can see that the organs are connected and they're not supposed to be connected. Other complications include mineral and vitamin deficiencies, osteoporosis, colorectal cancer could also come from Crohn's disease if it is left untreated, anxiety and depression, and like I said in the symptoms, joint pain, arthritis, and then liver and kidney disorders. Something that isn't listed on here are blood clots, so blood clots could also come from Crohn's. So the treatment for Crohn's could be medical or surgical. There's no cure for Crohn's. So medically, there could be anti-inflammatory medicine to try to reduce the inflammation. Corticosteroids could help flare-ups, but only for a short amount of time. It's only short-term because there's a lot of side effects, such as like infection or mood swings, bone loss, or like cataracts, so it's not good to use for a long period of time. And then some antibiotics. There's also a surgical treatment. 70% of people undergo this treatment, however, more than half of them experience recurrence. Some stats of Crohn's is that the male and females are equally susceptible to Crohn's. So it's not like females is more susceptible to get Crohn's than males. They are both equal. 200 out of every 100,000 adults suffer from Crohn's. So Crohn's is seen a lot in Americans. Crohn's are seen more in Caucasian and Jewish origin than other ethnic and racial groups. When people are diagnosed with Crohn's, they are more diagnosed as they get older. So as you can see from the from the chart right here is that for people 40 and up, they are diagnosed more than 0 to 10-year-olds. However, people after 15 is when they start getting diagnosed. And these are my sources. Thank you.